Getting up more at night to pee is a common occurrence as we progress through life. Many men think it's simply just an age-related process and they have to put up with it. If you do have urinary symptoms, it's possible that you have BPH or benign prostatic hyperplasia. This is a benign condition that affects the prostate more commonly as men age. In today's video, I wanted to highlight with you some of the common misconceptions with regards BPH or a benign enlarged prostate. Hi, my name is Dr. Charles Chabert. I'm a urologist and the director of the prostate clinic here on the Gold Coast in Australia. If you get value from this video, please subscribe to our channel, like the video, and let's get into it. So if we start, some of the misconceptions with regards BPH, and this is a common one that I see with many men that present to the clinic, really is that they feel that the development of urinary symptoms is associated with prostate cancer. One of the key things to be aware of with a prostate is, in essence, it's shaped a little bit like a donut, and we pee through a hole in the middle of the prostate. The part of the prostate that grows as we progress through life is the part that surrounds the outlet pipe. And so for the majority of men, the development of urinary symptoms tends to be associated with benign enlargement rather than cancer. Prostate cancer, when it does occur, tends to occur or arise in the outer part or near the shell of the prostate, and so really needs to be quite large in its size before it causes any urinary symptoms. So myth number one basically is the evolution of urinary symptoms is related to prostate cancer. That's not necessarily the case. Although BPH, benign prostatic hyperplasia, is far more common as men progress through life, it is also possible that men can develop urinary symptoms at a younger age, and BPH, in fact, can begin to show signs in the early 40s. Some of the signs and the features associated with BPH include urinary symptoms such as a slow flow, some hesitancy, or men can notice that they're getting up a little bit more at night to go and pee. Sometimes they rush to the toilet. So a misconception is that only older men develop BPH, but it's important to be aware that whilst this is true, it is more common in older men, it can also happen in men in their 40s. Myth or misconception number 3 is that BPH always causes severe symptoms. Now, like many conditions in the body, there is an evolution where things start in a fairly mild framework, and if left untreated or left unchecked, or if things aren't recognized at an earlier stage, there can be progression and evolution of these urinary symptoms with time. For the majority of men, what they begin to notice initially is that their flow is a little bit weak, so they have less pressure when they go to pee. One of the common stories that I hear is men notice that, for example, if they're at a sporting event, they're at the urinal, it takes them a lot longer to pee, and younger men are in and out far quicker. And that can be one of the heralding signs that they're beginning to notice that there is some kind of obstruction to their bladder. So a slow flow, and what accommodates that is an increase in frequency. With an increase in frequency, that can be both in the daytime and also at night. And so men begin to notice that there's evolution in the number of times that they get up at night to pee. One of the big drivers for men seeking out clinical assistance or a review from their physician with regards to what's going on is that they get up far too often at night, they're tired and cranky the next day, and they want to make sure really that there's nothing sinister at play. In its most extreme form, and this really takes years before this evolves, and the reason it takes years is because this is a benign enlargement, and we tend to see really severe symptoms in men as they age. They can be associated with a much larger prostate, but in its most severe form, men are rushing to the toilet and they're actually getting caught short. So they're leaking urine before they even make it to the toilet. And that can be associated with an increased frequency at night. That obviously becomes a fairly exhausting situation to live through. And again, that's what drives men for intervention. A lot of people that I see put off a review with their healthcare provider, really because they think that if they have a prostate problem, the only way that that can be remedied is with invasive surgery, and their conception is that invasive surgery comes with it a significant side effect profile. You know, the paradigm of BPH, or the way that we manage BPH, really has evolved enormously over the last few decades. Whilst it may be true that historically the options that men had for managing their urinary symptoms were really related to either have a tablet, have some medication, and if that failed or was poorly tolerated by an individual, the only other option that they had was invasive surgery, such as, for example, a TURP or a TURP operation. There are a whole host of other treatments that are available for men, and we have now several minimally invasive treatment options should men wish to take the next step beyond medical therapy to manage their symptoms. And really, this is on an individual basis. It depends very much on the age and the health of the man, depends on his prostate configuration, i.e., how big, what's the shape, how well does he empty his bladder, is he retaining a lot of urine? And also, are there significant complications from an enlarged prostate, or is this really just related to symptomatic relief? Some of the more minimally invasive treatment options that are available for men include things like iTind, UroLift, green light laser prostatectomy, and also Rezum. So there are options that you have. Talk to your healthcare provider. He or she will be able to give you a bit more information. But the traditional way of either a medication or an invasive operation really is becoming a thing of the past. Now, some men also think that if they dehydrate themselves, this will improve their symptoms. Now, I often say to men that the three biggest confounders to make your urinary function worse really are if you consume a lot of caffeine, so tea and coffee, if you drink lots of water through the day, and if men consume significant amounts of alcohol. So all of these things, they're basically diuretics. They result in the production of a lot of urine. And whenever that happens in a system which is obstructed, we can precipitate more severe symptoms. That doesn't mean that we need to deliberately dehydrate ourselves to try and manage things, but it does mean that men should be aware of what they consume from a fluid point of view. And for example, if men drink 2, 3, 4 cups of tea or coffee in a day, maybe they should start their management process really with trying to reduce the amount of caffeine that they take on board. Similarly, if men like to drink several beers in an evening and are worried about getting up multiple times at night, the first most simplest step to undertake really is a reduction in alcohol consumption in the evening to try and improve things. But certainly don't deliberately dehydrate yourself. I don't want you to avoid fluid to the point that your urine is dark and concentrated, because dark concentrated urine can actually exacerbate things by causing a local irritation to your bladder. Now, the final misconception that I wanted to highlight today really was that BPH causes erectile dysfunction. Many men think that if they have a swollen prostate, if they have urinary symptoms, that is the root cause of why their erections may not be as good as they used to be. In actual fact, the most common reasons why men develop erectile troubles as they get older really relates to issues such as metabolic syndrome, so blood pressure, cholesterol, sugar imbalance, previous smoking history, inactivity, excess weight. Those are the main culprits, rather than actually because you've got a big prostate, you're also going to have issues with sexual function. I hope this answers some of your questions. If you do have more questions or comments, please leave them in the comment section below. Look after your prostate. I'll see you in the next video.